Okay, welcome to part 7 of PBIS integrated with Time In for Schools. This one is awesome. We'll begin with some of the, the elements of Time In, but really begins to move into why Time In. You'll see that after the big orange slide. Linking childhood experiences, physiological impact of trauma, adverse child experiences, and studies that have proven that. And then go into the ACE numbering, and finally the CDC ACE study. Very interesting. I think you'll enjoy it, and as usual, the slides will follow at the end.
I see it as a state of being, and when it's embraced by a group, like you're embracing here, I see it as a part of your culture. It's a backdrop to the culture of the programs, the education, and etc. that you're doing. So it does fit in real nicely, of course, with the, is that nationwide PBIS?
Yeah.
Yeah. With kind of the nationwide emphasis in education of positive behavioral intervention and support, that what you're establishing is a social culture and supports for schools to achieve both social and academic success for all students. At least that's what I see PBIS as being, and from the different things that I've been to in this area, that's what I have seen. So, in terms of Time In, some of the key elements, just as a construct, is one was boundaries. And we talked about the safety. A child needs to feel safe in their environment in order to focus and in order to learn. Okay? So, unless I feel safe in your classroom or in your school or in your community, it's harder for me to put my focus on learning, because I'm using a lot of my energy to continually scan or to be aware of my. So the less predictable my environment, the less safe I feel. Okay, and so one of the things of safety is that schools have rules and they have consequences. So I know that if something happens, there are those around me, teachers and staff, who will make this a safe environment for me so I can focus on my learning. Okay, so that becomes important. Predictability, the routine. Okay, consistency and repetition. We do know in theories of education that repetition is a very important way that we learn. It's also how we learn social emotional development, is by repetition. You know, if every time I do this, you respond to me in this manner, or if every time in your classroom there's the same kind of routine going, then once again I get to focus more, I trust you more, I build a relationship with you, etc. And of course then the other one is caring others, which is positive relationships, and that's social support. And we know that a sense of being cared for is critical to human development. All of us want to feel like somebody cares about us. And I can't tell you how many times in my career that I've heard from a student that, or from a child, that the only person that they ever felt cared about them was their teacher, or a teacher in their life. You know, that they felt they really cared that they learned something, or cared that but positive relationships. So these are the ones: safety, routine, and positive relationships. And I think they fit well into your vision here with the best vision, you know, in terms of safety, responsibility, and so what was the first one? Respectfulness. You know, so they kind of fit in that same kind of thing, because your vision is going to be important to driving how then you implement that. So you have safe, consistent, predictable, and positive in all school settings was kind of what we came up with for how Time In would fit at Pinyon Mesa. Okay, so that was the statement that we came to as a group, was that. And so the thing that I would hope, in order for the implementation to be working, can we go back to that one? Is that in order for this to occur, that routines and expectations are clearly stated and defined continually throughout the school. Okay, so if I'm a student here, in order for me to know or to experience the culture of Time In, I need to know clearly what your rules are, okay, what's expected of me, and that I can meet those expectations in that environment. And it's often the disconnect between those and how a student might feel that creates the disruption in school and in the classroom. So if I don't clearly understand the rules, I may not clearly follow them. If you're making expectations I can't meet, okay, then I'm not going to be able to do those. So sometimes that's the mismatch. And sometimes we don't even realize that the mismatch is occurring. We see behavioral manifestations, but we might not know that that's the etiology of it. And so that's when we have to come together and look at the backdrop of that. And I'll talk more about that as we get into that, but we really need to have those things clearly stated. So for Rob Horner, who's one of the PBIS experts, who says the same thing. So once again, it has that, it's not like we're taking you down a different pathway, it's reinforcing the pathway that's encouraged in that we need predictable, consistent, positive, and safe environments for our children in order for both the social and academic learning to occur. So then it comes to why time in. So when I was looking over some of the survey results, it was a little bit about, I felt there was some indication of that time in might be more of a directive than a collaborative experience. Does that make sense? Okay, it's like, oh, okay, so here's another thing, and it's a program. And so some of the comments were related to, you know, kind of what were the program elements, what I call the recipe. And I'll tell you right now, if it's a philosophy and a state of being, there's no real recipe for it. There are tools or ingredients that might be useful. There's no real recipe because it's related to the individual situation, the classroom, and the school. And so I would see you, rather than following a recipe, I see you all as creative chefs. And so that's sometimes a harder one to embrace, especially if you haven't had as much time cooking. So that's where it comes over. So, but why time in? So this is where I'm going to go off on, you know, why do I see it as important to what I do? And for those of you who might not know what I do, my expertise is in children who've experienced trauma and or live in a drug-endangered environment, and almost always those are combined. Okay, pretty much 85 to 90% of children who are in the child welfare system are coming from homes where drug endangerment is the issue, okay, or is at least a component of it. So those are often. And what we see, if we look at just in general, children, and then how we think about their trajectories. What we do know is that impact of early experiences later in life, the impact of early experience later in life is very variable. There is so much data on that from a variety of things, and I'm going to focus on one particular study, but there is so much data on that. In fact, who was the first I want to say professional who really talked about the fact that what happens to you in childhood matters? Absolutely, Freud. Okay? So prior to that, if you think about the time and the era and what was going on, a lot of these little children were working in mines, and, you know, I mean, it was the workforce, 5-, 6-year-olds were workforce, and, you know, all of those kinds of things. And it wasn't that Freud cared to change childhood, right? His daughter eventually did work with children, but he just was working with adults, and he was the one who made the connection that what happens to you as a child impacts who you are as an adult, okay? So that was back then, but now we know it on a much deeper level, okay? And I want to talk to you a little bit about that because you are the early experience, okay? You make a huge part of that up. So when I was here last time, I talked about a report that was called Hardwired to Connect. And there was a question in our country of why are there so many children on mental health waiting lists in this country, and what should we do about it? And they got together about 30-some of the top child professionals, child mental health professionals in the country, to look at what that was. And so what they came up with is for a child to have healthy well-being, to function well, to do their occupation well. An occupation of a child is to eat and sleep and play and go to school and learn. Okay? To do that occupation well, a child has to have connectedness or a relationship with healthy adults and a sense of purpose or meaningfulness, a value system or a spirituality. Okay? That's essential. And then they put in that report a ton of the literature that shows, in terms of that relationship thing, that all development, every part of it, whether it's memory or learning or whatever they're doing in your classroom, happens in the context of relationship. And we're not going to go into it today, but last time I talked about how that begins at birth. Okay, so that begins at birth. But through childhood, those experiences are laying down the impact for adult outcomes. Okay, so both in school, you have both the need for connectedness and a sense of purpose or value. Okay, those are essential then to the child's well-being, and well-being is essential to behavior in the classroom. So we'll then now. So when we think about, remember I talked about a lot of times the cultural difficulty is when the expectations of the child are different than what the child's capabilities are. So I'm going to take that a step back, and it's not expectations necessarily in terms of IQ or academics or those kinds of things, but sometimes it can be expectations related to psychosocial development. All right? And it can be expectations related to the child's own experience of how to behave in the world. Okay? So if I can't tell you how many times I hear this, especially from foster parents, but it can be in different settings. Things are all peaceful, things are all going well. Think about your classroom. We're all getting down to the work and doing it. But for some reason, whenever that's happening, this child has to create chaos. Okay? Because the child comes from, and I'm going to talk about this, comes from an environment where stress in the environment, it doesn't have to be abuse, but stress in the environment, continual chaos, no daily routine, whatever it is, abuse, neglect, whatever it is, drug-using environments, parents not available, I don't know what all of those variables are, that creates stress in the child's brain, affects their brain architecture. Okay, so we're talking about here where the literature says toxic stress for the child is the black box that will indicate poor outcomes in adulthood, right? So I want to talk about how that impacts in the now, right? So in the now, they have toxic stress that affects the brain architecture. So if my homeostasis point, you know what that means, you know, like you're that's your baseline functioning. In my environment is chaos. What is it I bring to every other environment? It's chaos, right? So childhood adversity has toxic stress that affects brain architecture, and we know it develops poor adult outcomes. So I want to tell you, I don't think we went over the ACE study last time, did we? We've never gone over these. The ACE study, I always had a passion for what I did, but it put a little fire in that passion for me because I felt it gave me data to say, come on, this is why we do what we do. This is why we need to make a difference. And this is why you've dedicated yourselves to be teachers. Okay? So, every event that we have leaves a record in our brain. Okay? And your brain is altered by the nature of those events. This was a study that looked at adverse childhood experiences, and the hypothesis or the premise of the study was that those experiences alter development and lead to a lifetime of vulnerability. It's based on that black box thing that I just told you about. So it was actually done by Kaiser Permanente in Southern California. where they had 17,000 of their adult members respond. It was the largest epidemiological study that has ever been done. And they matched childhood experiences, not necessarily with adult mental health, because they are an insurance company, and they're looking at why are their members sick all the time, right? So they're looking at health. And it didn't score events, it just scored whether it happened or not. But I want to say something, is because sometimes philosophically these things are important even though if they're in a different field. This study didn't come out from saying, oh, we really want to know why is child abuse bad. That's not where it came from at all. It wasn't really caring about childhood per se in general. But what happened was Dr. Folletti was internal medicine in a bariatric center, working with patients with obesity. And he had patients who, after their bariatric surgery, experienced severe psychological distress, okay? And had suicide also in that population. And what the message that kept coming back from that was that you did not take away, or you did not take away our problem, you took away our solution. And I want us to think about that because, you know, for them it was about how their weight gain, a lot of them had had sexual abuse. I'm not saying everyone who's overweight has this, but in that population, there was a large number of them who had had abuse, of which some of it was sexual abuse. And so having a body they didn't feel comfortable with was very significant to them in a solution for how to handle life. And I want to say, and I don't have an example that's coming to my head at the moment, and all of you are in the classroom every day and I'm not, but sometimes by doing some strategies we do, we take away, we don't deal with the problem, we're taking away their solution to their problem. It doesn't mean it isn't the right thing to do, but sometimes there's a backdrop to that that we have to be aware of. And so we'll get into how that. So what I want to show you is, and remember, whenever I do this talk, this part of my talks, everybody's adding up their scores. Okay. Remember, I'm going to talk about how significant this is, but the fact that you're sitting here knows we believe in resiliency, and we know that there's a way to move beyond our experience, or through them, not beyond them, but through them, to be healthy, functioning adults. But I'm telling you what the mass numbers, okay, what they said, okay? So here are the 10 things that were looked at. There are 5 related to the child's experience, 3 of abuse and 2 of neglect. Now remember, it's not substantiated because remember in life, our psychological experience is about what we feel happened, not necessarily what's substantiated. And that's where if I'm working with you on an individual level, I have to go, right? Whether it's real or not, I have to go there to help you through these things, okay? So those are the 5 different things, 3 abuses and 2 neglects. If you had none of them, your score is 0. So for each one, it's 1 point. Okay? So overall, it's a score of 0 to 10. Here you could have 0 or up to 5. Then it was looking at household. In your home, was there a substance abuse problem? Did a parent separate, divorce, or perhaps die? Depression or mental illness in the family? Domestic violence in the home? And was a family member in prison? 0 to 10. Okay? So, what they found, this is the conclusion. Those of you who are interested in any of this, if you go to the Centers of Disease Control website, there is a whole domain on this study because of its impact and how powerful it is, okay? But if you take and distill the results, the conclusion is the greater the number of childhood traumatic exposures, the greater the risk of early adult disease and death from any cause, okay? And many chronic diseases of adulthood are determined in your childhood not by disease, but by things that happened to you as a kid.
So why isn't Kaiser making worldwide preschool for everybody? Bottom line, kids preschool, I mean, for free.
And middle school, and all those things. So I can never take away a child's ACE score, but we're going to talk about then why time in became really important to me. So what they found is that as the ACE score increased, so did a ton of different things, whether they were mental health or social relational issues or disease issues, etc. Remember, this began in a study with patients with obesity, but it's in cancer, it's in diseases, it's in chronic diseases, asthma, allergies, all of that. And it increases in a graded fashion. So every one more point means you have more risk. So one of the examples in the research was that a male child who has a score of 6 has a 4,600% increased risk of becoming an IV drug user than a kid with a score of 0. So think in your classroom of that kid who is the most out of control kid and think that he has a score of 6, and that's a real high likelihood of his trajectory if it isn't already occurring. Because while in the country 13 to 14 is the average age of experimentation, 9 to 11 is average age of use in Southern California. Okay? So, yeah, if it's been in your home, okay, not general, if it's been in your home, okay. So I don't, yeah. So, okay, then the Centers of Disease Control said we want to study the elderly population, the over 65, and they chose to choose a score of 6 or more as the highest risk group. And guess what? They couldn't do the study. You know why? And they said it was like trying to study, coal mines and lung cancer, but in the elderly, but they've already died. So what they looked at in terms of the data was that if you had a score of 6 or higher, your risk is to die 20 years younger. Okay? So this to me was like when I was working, and I'll tell you, I had a kid in the hospital. We found him up here in your community. The law enforcement found him in a gang home. He's a 5-year-old kid whose score was 10. So he gets transferred. Okay, but I want you to embrace this because they're in your classroom. Okay? But I'm going to tell you about they're in the hospital, okay, first. So this kid needs to go to the hospital, has all kinds of marks, stuff on him. He needs a full workup. He's emaciated. He's got all kinds of stuff on him. He comes to the hospital. None of the nurses want to work with that kid. Because his language and the way he treats females, he was in a good gang home, and the way he treats females is rude, derogatory. I mean, it's disgusting, right? You bitch, get me that, or his whole vocabulary was it's his environment, right? So I went aside to the nurses and I said, "Have you ever heard of the ACE study?" "No, what's that?" So I talked about it, and they were like, "Oh my gosh, that's so horrible." I said, "Guess what Johnny's score is? It's 10. If we don't start doing something, he's dying 20 years younger, he's going to have all this blah, 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 all of these kinds of things." And I said, it doesn't make how he's treating you right. But we have to find approaches on how to time in with this kid in a way that's going to change his trajectory. And to me, that's the reason I do what I do, is that I don't know all the answers. I don't have all the risks. But hopefully, in a group of others, I'm going to find tools that will work to do that. So I immediately, although it was an unusual one because he had a lot of words, he didn't have a speech impairment, I did a speech consult. He needed to learn how to speak appropriately, right? Because he was getting in trouble all the time with the way he used it. So it wasn't the traditional in the hospital, swallow study, can't say words, are they, whatever. But it was a need for speech. Okay. So we did that consult because we had to think outside of the box because nobody wanted to care for him, or particularly not the female staff, because of the way he treated people. But this is where, you step back and say, I am solid in who I am because I have you and I have a grounding in how I believe and in who I am. And so I can be more than what this child does to me. And it's so important. Otherwise, it will burn you out. Okay? Because if we personalize what those kids say or do to us, it's just, the gift of you cannot be cheapened by the reception of who you give the gift to. It's very important for you to be able to continue on day to day. And I know that your administration here, one of the things said way back was that when you go home every day, we don't want you to go home. We don't want our teachers going home feeling like they're so stressed out, work was horrible today. You know? That's a wish. It's not going to happen all the time, but if there's a way we can work together on that, knowing that sometimes kids aren't going to, as a mentor of future pediatric psychologists, I'll tell them, you better not be in this field because you think you're going to get all your internal kudos met in life by kids telling you you're great. That ain't happening, okay? But the thing is, you're in this field not to be their friend. You're in this field because you want to help change those trajectories in their life. So,
Welcome. And as we move to part 8, Dr. Randall will talk about a pyramid, and it's the model of adverse childhood studies, which describes all the differences that and levels of why children are where they are from adverse conditions. She'll also talk about the ecology and health template and how procedural memories affect classroom behavior. And then really what is really cool is who are these time-in children. And then again, time-in takes time. It's a challenge. But you are an agent of change. And as always, the slides will follow right after.